I'm going to jump right into it. This is a training on Medicare Advantage special elections. Okay, and this is what I'm going to do is go over the functional tools. And given the time we have, there's a lot to know on the special elections, and even having a full hour to go through it wouldn't be good, enough time. But what I want to do is make sure that everyone understands the functional elements, so that instead of feeding you, we're teaching you how to fish. Okay, so let's jump into it here. So first off, I want to make sure everyone understands what the role of special election periods are. Okay. Your first job when you're meeting with a customer is to identify opportunities to help them. Okay. Understanding special elections is very important, but it's not more important than this. Okay. Now, once you identify what those opportunities are, now the work is finding a solution for that customer. Okay. And that's where, it could be Medicare related. It could be hospital indemnity related. A lot of times we get tunnel vision and we lock in on just one thing. We're trying to figure out, how am I going to sell this customer a Medicare Advantage plan? Where we really should be saying, how do I help this customer? Okay. And that broadens the array. I use this analogy all the time. A lot of times, I'm a carpenter. Customer says they have some work that needs to be done in their house. I show up with a hammer and I'm looking for nails. Okay, we have a whole toolkit full of different products that we can help our customers with. So again, it's finding the challenges, offering a solution. Next is getting buy-in from the customer on the solution. Okay, so it's very, very important that the customer understands, hey, look, this is what my problem was. This is the solution to that problem. And I agree that this is going to be a solution to my problem. All right, once you've done that, then you look for ways to put your solution in force. And that's where SEPs come in. So again, I love my analogies. SEPs, finding special elections, is like finding a pin. Okay, as a salesperson, you've already sat down with the customer, you've built rapport, you've established trust, you've uncovered needs, you've provided a solution. The customers bought in, they're ready to sign up. And then you look, you say, oh, I don't have a pin. Okay, how am I going to do this application? I don't have a pin. That's the role of special election play. This customer is interested. They understand that a Medicare Advantage plan is going to be the solution to their challenges. Okay, but now it's, how do I get this person into a Medicare Advantage plan right now? Where's the pin that I ink this app with? All right, that's the role of special elections. So again, you've got to lead with need. Show you care, show you understand, build trust. Everything we talk about in the 10 steps, I want to emphasize that, because a lot of times we do a training and then folks go out and they have their whole conversation. It's like they start asking questions, trying to find special elections, and your whole objective of your conversation with the customer goes off track. And if you go in asking a bunch of questions at the beginning of your consultations, trying to identify special elections, it's going to sound like a traffic stop and being interrogated by a police officer. Okay, so the key thing is you want to make sure that you're doing things consistently. You're showing you care, you show understand, you build trust by sharing information and insightful stories, asking good questions, and then demonstrate that you're listening. Paraphrase things back to them, so forth. So let's get into the actual SEP training. So what I'm going to go over today are four functional tools. Number one, Google, Medicare.gov, Cigna.com, specifically for Cigna products, and then tools that are available on Global Premier Benefits specifically to this topic, I should say. So first, the special elections document. Now, Medicare Interactive put out a great document that's available that covers all 20 of the special elections that are available. So I'm going to put that document on screen. But really what I want to make sure everyone comes out of this training with is not, hey, I need a copy of the PowerPoints. It's, hey, I know where to get information, okay? So the PowerPoint presentation, the slides we put together, the information is coming from the sources that I'm sharing with you. So what I would rather do is make sure you guys understand where the source is and how to navigate the source. And we'll talk about the special elections as well. But outside of this call, I don't want you to be handicapped by thinking there's some black box technology that we have at Global and you have to wait for us to give you the information. We're going to show you where we get the information from. Okay. So to get the PDF that I'll be going over today, you Google Medicare Advantage SEP PDF. You find a document. It should have a header called Special Enrollment Period - Medicare Interactive. Medicare Interactive is the organization that created this document. Okay. Once you open that document, it should look like this. It should say special medical. I can't even talk today. Special enrollment periods for Medicare Advantage plans and Medicare Part D drug plans. So it's important to understand that this is not just Medicare Advantage. This is Medicare Part D as well. It's really more so Medicare Part D. And in many cases, the reason a person's able to enroll is because MAPDs have prescription drug coverage. They have a Part D. So the Medicare and health part of it gets to piggyback along with the drug coverage. Okay. So this is the document I will be going through today. So next part of it. Okay. That document, once you open it, is going to have a listing of 20 different special elections. Okay. To simplify things for myself, and I'm just going to share with you my learning tools and process. I categorize them, okay? Because this is going to allow you to have an idea of what to look for, okay? Now, this isn't all 20 of them. Some of them are redundant in a sense in terms of being the same classification, and we're going to go through that in a moment. But really, they fall into 4 categories. Income. So when I'm talking to someone, and I'm trying to, if they're lower income, then I know that there's maybe an opportunity for a state pharmaceutical drug assistance program, extra help through LIS, the Medicare Savings Program. Those may be options for that senior citizen based upon their income. Okay. Location. Okay. Has this person moved? Have they, and that encompasses a lot of things. Have they moved? Have they left the country and come back in? Were they recently released from incarceration? That's a move. So again, has there been a change in their location? Okay. Institutionalized. Again, that's a move as well. Okay. If that person has gone into an institution, there's a whole nother class of programs that are available for them. If they come out, that's an opportunity as well. So again, their location, I mean, more specifically, has there been a change in their location recently? And that's another important point. Has it been recently? Or do they foresee there being a change in the near future? Okay. Change of status. Again, large classification, loss of coverage. There's a lot of different ways they can lose coverage. Retirement. They didn't pay their Part B. There's a lot of different things. But the bottom line is, hey, if I'm talking to someone and they say they lost coverage, ding, 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 potentially there's an opportunity for a special election. Same thing with subsidy. Someone, and I say loss, it's actually gaining or losing a subsidy. So we talked about state pharmaceutical assistance, LIS, Medicare savings programs. If they gain or lose those, that also creates an opportunity. So someone having it is really the income side of it. So if they have it already, that's an opportunity. But if they lose it, that also creates an opportunity as well. Okay. Someone turning 65, there's a whole class of special elections that are tied to that. Not just the turning 65, there's a couple of others as well. But there's a couple other scenarios, and I'll walk you through that. Eligibility issues. This is Medicare eligibility issues, and we'll talk about that in a moment. The last class is industry. And this is the one where your expertise is really going to be helpful to the seniors, because in many cases, they're not going to know this stuff. This is industry speak, like 5-star plans. Okay, even if they know what a 5-star plan is, they may not know that it creates a special election. They may not know what plans are available in their market. And that's just one part of it. If a plan has very good rating, 5 stars, that creates a year-round AEP opportunity. But on the other side of it, a plan is like a 1-star plan, that's a bad plan. And there's a special election where customers can actually bail out of that bad plan and move to another plan. A lot of folks don't know that, okay? Plan specific. There's a lot of situations, if a plan is discontinued, or there's a mass exodus of providers. There's a lot of special elections embedded that are plan specific, market specific. We talked about FEMA as an example. Okay, there's going to be opportunities where there's special elections that are available based upon that market and certain conditions that existed within that market. Okay. Now the document I referenced is going to look like this. The Medicare Interactive PDF. Now, it's not going to look exactly like this. This is all going to be in black. What I did was color code the special elections based upon the color code up at the top here. So the income related special elections are in green. The locations changes are in blue. Okay, so that just gives you an idea. And there's actually, when you're doing the application, many of the carrier applications will be even more granular as it relates to the special elections. As an example, you see a move, a permanent change of address creates a special election. However, when you're looking at an application, there's a subcategory of that as well. I mean, there's a person that changes markets and a special election is created if the plan they're in now no longer exists in the new location, or there's new plans available at the new location that were not available at their old location. Okay, now that's, you know, the large chunk. But there could be a situation where a person has been an expatriate living overseas and they came back home. Okay, that same rule applies, because if they were living abroad, that Medicare Advantage plan would not have been available to them. So it falls within that same rule. But when you're coding the application, we'll talk about that at the end, you have to make sure you're using the correct code. Okay, so let's go, let's actually look at the actual document itself. And then we will kind of talk through each one of the different scenarios. So I'm gonna come out of the presentation. And as I mentioned before, you wanna Google Medicare Advantage SEP PDF. You should see this document, Medicare Enrollment Period, Medicare Interactive. Once you open that, where is it? There we go. Then this document is what becomes visible. Now you notice this is all in black. The one I was sharing before was color coded. All right, so now let's kind of talk through these real quick. Number one, credible coverage. Okay, so you have credible coverage or lose credible coverage through no fault of your own. So the key thing here is that if someone lost their coverage, they were working as an example, and their employer dropped their coverage, or they retire, they've got, well, actually, instead of me stating it, let's look at it. So no fault of your own, you lose drug coverage that is at least as good as the coverage they can get through Medicare. So it has to be at least as good, okay? If they lost coverage, then they can join a Medicare Advantage plan with drug coverage or standalone Part D. So remember, this is a Part D benefit. Effectively, MAPD plans have drug coverage so that you're getting the benefit of that enrollment opportunity because the MAPD has a drug coverage also, okay? They have a special election that begins 2 months after, I'm sorry, it lasts up to 2 months after they lose their coverage, or 2 months after they receive notice. So in other words, if someone is leaving their job or their employer is dropping their coverage, they're gonna get a notice in the mail. They have up to 2 months from the time they receive that notification to make an election, okay? And then the plan goes into effect the first day of the month after they submit their application. So if it's April 5th and I get notification at the end of this month, I'm losing coverage, okay? I have a special election that will take me 2 months from now. If I enroll in a plan today, that plan goes into effect the beginning of May, okay? So you wanna make sure that you're probing and again, asking for changes, all right? And I'm gonna go straight down the list. And the key thing here is I do encourage, if there's questions along the way, please, go ahead and ask questions. Bear in mind, there are 20 special elections, so we can't go down a rabbit's hole on long stories if we're gonna get through all of this. But if there's any, subtle nuances that anyone wants to share, by all means, just let me know. Next special election, Number 2, you join or drop employer health and or drug coverage regardless of whether it's credible. Employer coverage may be current or former retirement plan. So in other words, what they mean by that is you're working for Acme, manufacturer, and they offer benefits to their employees. You retire and they offer benefits to their retirees as well. Okay, you can opt out of the retirement plan coverage and you can take advantage of MAPD as well. Okay, And in this instance, what they're saying is that if it's an employer-sponsored coverage, doesn't matter whether or not it's credible or as good as Medicare. You have a special election. You had coverage before, and now you have the option, once you're opting out of that coverage, to take advantage of the private market and enroll in the Medicare Advantage plan. Okay? So the key thing I want to make sure everyone understands, again, going back to the functional side, this document is going to break down for you what the conditions are to have the special election, how long that special election will last, and when that coverage will go into effect as a result of a customer taking advantage of that benefit. Okay? Any questions so far? So I'm going to keep rocking and rolling so we can get through this and have discussion at the end. Okay? Next, institutionalize. Okay? So if you move into, reside in, or move out of a qualified institution. So again, it's either moving in or moving out. For example, Cigna has a completely different program. I think it's called Traditions, for people that live in nursing homes. Okay? So the MAPD plan that you have them in may not be appropriate for them if they're in a nursing home. Okay? PACE also comes into play as an option as well. Or if they move out, sometimes, hey, there's a miraculous improvement in their health and well-being, and they're released and they're able to go home. Well, now the institutional plans may not be the best fit for them anymore, and now a private individual plan may be a better fit for them. So you have the opportunity in those instances. So you want to listen for those keywords, because the thing to remember is this. Let's say someone's on a Medicare Advantage plan or a supplement, whatever the case may be, and they're institutionalized, okay? And they're in an institution, for rehab for an extended period of time, 3-4 months, let's say, as an example. They have the opportunity to enroll in a different plan that's specific to those circumstances. So now they're in rehab, their circumstances improve, and they're able to be released, okay? The plan that they enrolled into while they were in that rehab center or nursing center may no longer be a good fit for them. So now that they're leaving, they're going to need new coverage. That creates an opportunity, okay? So that SEP lasts for, once they move from that institution or move to the institution, they have the opportunity to make a change as long as it's done. And actually they can make changes if they're in the institution once a month. Now, if they move out, they have 2 months to enroll in a plan, just like if they're losing coverage. That's effectively what's happening. They move out of a facility, they've got up to 2 months to make an election to enroll in a Medicare Advantage plan. Does that make sense? Questions, thoughts, feedback? I feel like I'm talking to myself. Everyone good?
Good stuff, Don. Good stuff.
Perfect. All right, so let's keep moving. We got 20 minutes and we're only on number 4.
I have a question.
Okay.
Information on the site.
Do we have a plan that's for people who are institutionalized?
Yes and no. Cigna does offer, I think the plan is called a Traditions plan, but to my understanding, only employee reps of Cigna offer that plan.
Okay.
Great question. Now, I'm sure other carriers offer plans as well. I'm just not familiar with them, to be frank. Okay. Great question, though. Next one, State Pharmaceutical Assistance Program. Okay. This is probably the best way to frame it is the state level LIS or Extra Health Program. Okay. So many states, especially in the Northeast, Maryland, Delaware, Pennsylvania, New Jersey, who have I missed? Those are perfect examples of states that offer state pharmaceutical assistance programs. They operate very similar to LIS. The big difference between them and the federal Extra Health Program is that the income guidelines are far more lenient, okay? So you can have someone that does not qualify for the federal Extra Health Program based upon their income, but the state has a program that they can qualify for. So how do I find that out? So this is where we're going to go back to Google. Actually, we'll go to Medicare. So if I go to medicare.gov, in the search bar, if I type in state programs, you'll see State Pharmaceutical Assistance Program. If I click here, it's going to give you a grid. Oh, that's not the right one. Hold on. Oh, hold on. That's the wrong one. That's a good one. This will help you based on the prescription. So in other words, a lot of time the manufacturer of prescriptions will offer programs, and there may be some other private programs that are available. So you put in the name of the medication. You might have a senior you're working with who has a high cost medication. You can put in the name of the medication and see if there's any assistance available for them based upon the actual prescription they're taking. But that's not the one I'm looking for right now. Hold on a second. What happened to the state program? This one. Let's see if this doesn't look like it. Give me 1 second here. I love technology, doing this live.
John, I thought it's one where you can go to GPB and you click on that and it has the state pharmaceutical already there.
Yeah, it's in Zoho as well. I'll do it that way. It's taking
you can go back to the page you had and that where it says can't find your drug. Click that, something will pop up about the states. Click that and it'll ask you which state you're looking for.
To it. I'm gonna take the shortcut. I normally do this through Zoho, and that's why everything is bookmarked. Give me 1 second. Let me just pull up a lead real quick. So for Zoho users, this is already embedded in Zoho. So if you scroll down, you'll see state programs. And this is the page I was looking for. All right, so now this is still on Medicare.gov. So if you look for a pharmaceutical assistance program, I thought state programs, that keyword would have brought it up. For some reason it didn't. So for example, in Maryland, if I click view programs, it will now show me the programs that are available in the state of Maryland. Okay, now if someone needs adult care, that's a great option, but this is gonna be universal in that, most folks, most seniors are gonna be taking some type of prescription. And the key element here for the state pharmaceutical assistance program, specifically in Maryland, it's 300% of the federal poverty line, okay? In Maryland, that means that a senior can be making over $30,000 a year and still qualify for the state pharmaceutical assistance program. What this program will do is pay up to $40 a month of their Part D prescription, okay? It also has provisions to make sure that they have coverage through the donut hole. And it creates a special election. So adding it creates a special election and having it creates a special election, okay, during the first 9 months of the year. Now, this particular special election, LIS, Medicaid, in the fourth quarter is not available, okay? So I want to make sure everyone understands that. Having it does not create a special election. Adding it does create a special election all 12 months of the year. So this is an important distinction. I want to make sure everyone understands this. So if I'm talking to a customer in October and they're on original Medicare and they're lower income, and let's say I help them get Medicaid and LIS, that does create a special election so that they can enroll in a Medicare Advantage plan because I'm helping them get it. Now, if I'm talking to another customer who already has Medicaid and LIS in October, they already have it, they can't use that special election during the fourth quarter. Does that make sense?
Yes. Hey, John, does that also eliminate these state programs? Don't they typically eliminate any penalty if someone had one?
I would look at the actual plan specifics. I don't want to make a categorical, because each state is different. So I don't want to make a blanket statement and mislead anyone. I would look at the provisions of the specific plans and let that be your guide. Great question though, okay? So any questions on this one? Again, I'm going, like there's 20 of them, so I gotta, we could probably spend 10, 15 minutes on any one of them. That'll be a 3-hour meeting. Any questions here?
John, this is Tamara. I have a question of clarification. The person has low extra help, okay? They have not made any changes, but in the fourth quarter, they cannot make a change? Or
not using this particular special election, no.
Gotcha. All right, thank you.
If they already have it, the fourth quarter, they can't use it. If they don't have it, or they had it and they lose it. So that's another distinction. I'm talking to a customer who's been on Medicaid all year long. They fail to recertify and they lose their Medicaid. Now let's say they're on a total care plan and their cost share are high because the plan is structured so that the state and the Medicare Advantage plan are sharing the majority of the costs. If Medicaid is no longer involved, that means the customer is now responsible for paying the portion the state pays. Okay, they don't want to stay on that plan. So if they lost their Medicaid, they have the opportunity to use a special election to get out of that plan. They don't have to wait till the first of the year. That would be a painful process in a horrible holiday season for a senior having to kick out all that money.
True. Okay, thank you.
Just for clarity, John, though, we just want to make the distinction. They do not have that special election, but during that fourth quarter, they have the annual enrollment. That election is still there for them to make the change.
When you say them, who are you classifying them in this example?
Anyone that has Medicare during that fourth quarter, they have that annual AEP election.
Correct. If they already have it, but if they gain it or lose it, they do have a special election in the fourth quarter. So if someone first 9 months of the year does not have Medicaid, October they get Medicaid. That means that there should be a different plan available or can be a different plan available to them that they didn't have access to the previous 9 months of the year. They do have a special election. Or conversely, first 9 months of the year, they had Medicaid. October comes around, they lose Medicaid. They have a special election in the fourth quarter. So a change in that status creates a special election. If they already had it, it does not create a special election in the fourth quarter. Good to go? All right. So, is there a question? All right. So next one, you'll notice that Medicaid, the Medicare Savings Program and or Extra Help is basically what we're talking about here. So this is where it kind of lays out in specifics. I'm trying to get it all to fit on one page here. Bear with me 1 second. So here is where they're breaking out the details here. So sorry guys, it's split on across 2 pages. So the key thing here is this. The first 9 months, if they have it, okay, they don't have a special election in the fourth quarter, okay? Now, and that's where they're explicitly stating here, if they already have it, they can't make changes in the fourth quarter. However, where is that? You have it in your, okay. Here we go. It's the next section. Number 6, you gain, lose, or have a change in your Medicaid, MSP, or eligibility, okay? If they have a change, then number 6 is what applies to them, okay? And you notice there's no restrictions on when they can make that special election last. That's all 12 months of the year, okay? So number 5 and number 6 kind of go together. Number 5 is if you already have it. Number 6 is if you gain it or lose it. Okay. Number 7, this is related to turning 65. So number 7 is, okay, first, we know the basic rules around enrolling into a Medicare Advantage plan, 3 months before your 65th, the month of, and 3 months afterwards. However, what a lot of folks don't realize is that in that first year, I turned 65, I made an election to enroll in a Medicare Advantage plan. During that first year on that plan, I can opt to go back to original Medicare. In general, this concept is for that person that chose a Medicare Advantage plan and decides that they want to go a supplement route instead. So they go back to original Medicare, and what it does is it does allow them if you look at the bottom of this, to choose a Part D, because they'll need a Part D to go along with the supplement, okay? Also, on the flip side of that, the same person was on a supplement previously, they've never selected a Medicare Advantage plan before, and they switch from a supplement to a Medicare Advantage plan. In the first 12 months of being on that Medicare Advantage plan, they can again opt to go back to original Medicare, and they do have a guaranteed issue period to go back to the same plan they had with the supplement previously. So if you're talking to a customer, they've never had a Medicare Advantage plan before, and they've been on a supplement. They want to give it a try, but they're concerned, hey, my health has changed. If I leave this supplement, I may not be able to qualify to get back. I would let them know is, hey, look, let's try it for a couple of months, okay? Let's try it for a couple of months. And to be a good steward to my customers, I wouldn't say let's try it for 12 months. I'd say let's try it for 8 or 9 months. Because if they're gonna switch, I don't want to wait to the last minute and risk taking any, running into any headaches, okay? And it shouldn't take 8 or 9 months to figure out that whether or not they want to stay with it or not, okay? But this way they can try it, make sure it's a good fit for them. And if it's not, then they have the opportunity to go back. Does that make sense? All right, I'm gonna keep rocking here. All right, so you enroll in or disenroll from a PACE program, okay? Get a lot of questions, well, some questions about this. What is PACE? So again, I would go back to Medicare.gov, in the search bar, type in PACE. PACE Medicare. This will explain what PACE is. Effectively, a PACE program is for someone that is 55 or older that is in a nursing home or needs a nursing home level of service, and there's a plan available in their area, and they can safely live there. So if someone is, suffering from dementia and combative, they may not be eligible, based upon whatever certifications there are, okay? If a customer wants to find out if there's a PACE plan, this gives you a summary of the benefits that are provided. And if you want to see if there's a PACE plan in your customer's area, maybe you have a client that has been enrolled on a plan, they have to go into a nursing home. As I mentioned, Cigna Medicare Advantage plans we're not able to offer, but you want to see if there's a PACE program available for them. You can go to this link and it will just choose a state, and it will let you know what, if any, PACE program is available in that customer's market, okay? So the point is, if there is a nursing home level plan available and the person goes into a nursing care, that option is available to them, okay? They have a special election. If they're coming out of a nursing center or coming off of PACE, there's a special election so that they can join a Medicare Advantage plan or a Part D program, okay?
Hey, John, I apologize, but if you don't mind, on the last subject about say someone is 70, they've been on a supplement all 65 to 70, and then you're saying let's say it's whatever, July, they can get on a Medicare Advantage plan because they've never been on one. Is that a correct statement or no?
No, it's not creating, okay, this isn't creating a special election for them to go on the one. Well, you're talking about the last bullet. Is that correct?
Yeah. Yes, sir.
Okay, so this special election here is saying if you've enrolled on a Medicare Advantage plan and have never enrolled in one before, and you came from a supplement, you have a special election to go back to the supplement that you were on before without having to go through medical underwriting.
All right, so like during AEP, they're on a supplement, they go on a Medicare Advantage plan, and even if they're 70 or whatever, they have a whole year to try out the Medicare Advantage. And if they don't like it, they have a guaranteed issue to go back, correct?
Correct.
Okay, thank you.
Yeah. Great question. All right, next one, number 9. Again, I talked about this before. You move. Now, here's a key thing. A lot of people think that, okay, if I move, like I might move within my same state, and the plan that I'm in now is still available in my new location. Okay, a lot of people think, well, that I don't have a special election under those circumstances. That's not necessarily true. Sometimes you can move, and if there's new plan options available at your new location that were not available at your old location, you have a special election. okay? Because you didn't have the opportunity to select any of these other plans. So I'll use Maryland as an example, and I'm gonna, make up a little bit of things. So let's say I'm in Baltimore, okay? And I have, I'm living at zip code 21117 and I moved to 21045, okay? If the plan I'm in is still available in that other location, completely different county, but there's another company available that has a plan available in that market, I have a special election because now I just moved into an area that a plan that wasn't available in my old location is now available at. So that's my first opportunity to enroll in that plan, okay? So that's an important distinction. A lot of times folks are thinking, well, if the customer is in Humana plan and they move and Humana is still there, they don't have a special election. But if they don't have Cigna available where they were and now they move into a Cigna market, game on, okay? Number 10, you have Medicare eligibility issues, okay? I'm gonna roll through this fairly quickly. General premise, you have someone that doesn't have Medicare A and B, whatever the circumstances are. Let's say they enroll in the general election period, they sign up for Medicare that will begin in July. They have the 3 months prior to when they turn, that plan goes in, their Medicare Part B goes into effect to enroll in the Medicare Advantage plan, okay? I skipped one. Retroactive enrollment. So let's say there's something crazy to happen with that person's Medicare and they enroll retroactively, okay? They have the opportunity to now enroll in a Medicare Advantage plan for the first time because their eligibility is enforced retroactively, okay? Last one, you lost Part B, but you still have Part A, okay? This is important because you have folks that, for example, I don't know, maybe they have employer coverage or something along those lines. Or maybe they're using the VA. So they lost their Part B. I'm sorry, maybe they're using, maybe they're using the VA. You lost your Part B, but you still have your Part A and are involuntarily disenrolled from your Medicare Advantage plan. So you have a special election period to enroll in a drug coverage. Because if you're in a Medicare Advantage plan and you're disenrolled, you lose your drug coverage, okay? This allows you to put drug coverage in place so you don't wind up getting a penalty on both the Part B and the Part D side. Does that make sense? All right, I'll keep moving. Special needs program. So special needs program, this falls into kind of the industry side of things because we focus on the special needs programs that are available, or chronic SNPs, I should say, that are available through Cigna because that's our primary carrier. However, there are some other carriers that have other SNP programs, like Humana, at least at one point. I don't know how it changed with everyone now enrolling folks with end-stage renal disease, but had a chronic SNP program for people with ESRD. And there were some other like COPD and respiratory. So there are a lot of different plans that are out there outside of Cigna that have chronic SNP programs for different medical conditions. Cigna only has diabetes at this point. They used to have others and in select markets. So you have to look at the actual plan lookups, which is one of the resources that I referenced earlier. You want to go to Medicare.gov, you can put in the zip code. I said Medicare.gov. This is Cigna.com. And this will give you a rundown of all the plans that are available in the Cigna markets. Now, Cigna, their chronic SNP program is the Achieve plan, which is for folks living with diabetes, okay? So you can actually get the plan details, the application, everything right here on their site, okay? Market by market. So if you're just selling in one market, then I would learn this inside and out and you should be pretty good. If you're selling over the phone, it's gonna be a little challenging to try to remember every single market. You wanna use the tools that are available to you. Don't quote from memory. Go to the plans and make sure that you're familiar with them if you're gonna sell in the market, okay? And then make sure you're quoting from what you actually see in the summary of benefits. Because it's very easy to think, oh, the preferred plan, and I'm selling in Tennessee. Well, the preferred plan in Tennessee is different from the preferred plan in Maryland, as an example, okay? Same thing holds true, the achieved plan in Maryland versus the achieved plan in Pennsylvania. There might be some subtle nuances there. So you want to make sure that you're looking at the actual plan summary and quoting the right information. All right. So I'm going to, we're about halfway through here. So I'm going to give an abridged view from here, because there's a couple other things I want to make sure I cover. This is another part of the industry specific category. This is where, a customer's in a plan, and let's say that plan is under sanctions, okay? Someone's in a plan, unfortunately, we've been through that. The customer is in a plan that has been sanctioned or has been cited for, misleading marketing practices or enrollment errors. They have the option to enact a special election to switch plans, okay? So this is giving you categorically what the examples are. It's not all-inclusive. There are going to be all kinds of different situations. There may be individualized instances that are available. Okay, I think Joe, for example, I think in our last meeting, gave an example where a customer was enrolled in a different plan. They said that they weren't aware that they'd been switched. He made a phone call to, I think it was a Medicare or CMS, I can't remember. And he was able to get that customer switched back to the Medicare Advantage plan that he had them in. So those are categorically, if you have those situations where you talk to a customer, especially if it's one of your existing clients and they're, you get a chargeback, you talk to your customer and they don't realize that they've been switched, there's an opportunity to get them back on the plan, even though the other company may have used the available special election at that time to switch them. If that customer on the back end of that is saying that, no, I didn't want to change plans, there is an opportunity here. Okay. Another industry, Medicare Advantage plan or Part D no longer offers coverage. Sometimes the plan is terminated, okay? Now, the key there is, normally a plan termination is gonna happen toward, it's not gonna renew, it's not gonna have a new plan in the next year, okay? There's typically an extended election period or enrollment period in those instances. I think it goes through the end of February. The last day of February. So basically what happens is this. Let's say customers in Plan A. Plan A terminates and decides they're no longer going to offer that plan in the next year. It's AEP. Prior to that, that customer would have received their annual notice of change and they would have been notified in writing in the mail that the plan is not going to be effective in the new year. A lot of times seniors don't read their mail, okay? AEP comes and goes. So October 15th to December 7th, they have the opportunity to change plans. They don't change plans. What winds up happening in this instance from December 8th through the end of February, they still have another enrollment period, which will allow them to enroll in another plan because the plan they're in is terminated. So come January, they won't have coverage. Sometimes they don't realize until they go to see their doctor in January, and the doctor tells them your card doesn't work anymore, okay? They need to go out and get coverage. Now, unfortunately, that coverage won't begin until the first of the next month, but at least they have the opportunity to make an election then instead of having to wait until go an entire year without coverage. Make sense? Yep. Questions? Okay, I'm gonna keep moving. 15. Let's see, I wanna see if I can pick out some that may be more than the obvious, because we already know, we just came out of OEP. You guys know what that is. T65, someone turning 65, we already talked about that. 5-star plans, just to make sure everyone's on this. I touched on this earlier. So number 17 and 18 are talking about star ratings. So if a plan has a 5-star rating, that means that that customer, as long as they have Medicare Parts A and B, or live in the market and are eligible, they can enroll anytime they want. Conversely, oops, where is it? 17, 18, sorry. Oh, here we go. Conversely, if a plan has a consistently low rating, okay? So typically that plan has less than 3 stars. So it's a 1 or a 2-star plan. You have an SEP to enroll in a higher quality plan throughout the year. So if you're talking to a customer, you look up their plan and they're in a 1 or 2-star plan, that means that they can switch to another MA plan anytime, okay? So that's another important point. Oh, this is a big one. This is if a Medicare Advantage plan, drops, grow a large number of providers. Okay, let's say you're talking to a customer, they're enrolled in the plan, and their primary care physician, all their specialists are in that plan, and then the plan drops that network or loses that network of doctors. Okay, that creates a special election because the plan, in a sense, has changed. They enrolled the doctors that they are using, the providers they're using were in that plan, and then now all of a sudden all those doctors are no longer participating. That creates a special election because now it's forcing them to change doctors. And if someone is in, especially if someone's in treatment for an acute issue or even a chronic issue, a lot of times you don't want to make a change midstream in terms of who your providers are. You don't want to pick a whole new crew of doctors if you're going through chemotherapy or cancer treatment, okay? So that customer then has the opportunity to find a plan that their doctors are using so they can keep continuity in their care. Make sense? All right, we're almost there. Exceptional circumstances. And this kind of goes to, in part, to what Joe talked about. There may be other scenarios that allow that customer to have a special election, okay? The key thing here is that has to be coordinated through Medicare. You got to reach out to Medicare and kind of explain, hey, this is what's going on, because there may be a situation that just doesn't neatly fit into one of these other boxes, okay? What you want to do is be an advocate for your customer and help them navigate that process, reaching out with them, maybe doing a conference call so that you can find out if they can get a special election to enroll in the plan. All right. One of the last things I want to go through is now that you've identified the special elections, you want to make sure that you're using the right codes on the applications when you're doing an enrollment. So again, the paper application for Cigna and all the carriers have the special elections on the form. Okay, so you want to make sure you're using the appropriate codes. So a lot of time I get questions on, hey, what code do I use for this, that, or the other? On the back of the application, on this application, for example, I think page 15 and 16 have the special elections for Cigna. Let's see, here it is. Yeah, so pages 15, I'm sorry, it looks like there might be a whole other page, huh? Oh, it's the backside, never mind. So pages 15 and 17 in this document, there's a blank page in there, but this gives you all the special elections, okay? If you have questions on what code you should use, call the agent assistance line, okay? For Cigna, call Carl. Hey, I have a customer, this is their circumstance. I'm not sure which one of these codes I should use. Which one should I use? You want to make sure you put the right code in, because if you put the wrong code in, the application will be kicked out and that customer won't be enrolled, okay? All right, questions? I know we're at the top of the hour. Questions? Anyone? Come on, guys. John, this thing on?
Great job, John.
Thank you.
John, this is Floyd.
Hey, Floyd.
Hey, hello. I'm trying to find this document that you have on the site on alternatives. What is the heading?
John, I'm sorry. This is Weston. I got a question.
Hold on one second, Weston. Someone's actually talking. Floyd, you sound real far away, but I think I'm hearing you say, where is the document?
Correct.
No, I said I have a question.
No. Hold on 1 second there, Weston. So I'm answering someone else's question. All right, so if you go to, actually it's in the boot camp material. Let me show you there. That's the other website. So Associates tab, agent training, GPB Medicare Sales Bootcamp. If you download this document, that same document that I was referencing is here too.
Okay, thank you.
Okay. All right, Wesley, you had a question? You still there, Wesley?
There we go. All right. If you take them to the Social Security website and you are applying, you're checking to see if they qualify for LIS. And you put all the information in and it says you probably qualify for LIS. When you fill out the application and submit it, one of the carriers used to allow you to use LIS applied for, so that way you could go ahead and sign them up on the plan right then and there. Is that still the case, or is it just with that particular carrier?
Well, first step is, like, when you're submitting an application for LIS, unless something's changed, I don't know that it's going to tell you instantaneously whether or not they think you qualify. So that's the first part. I haven't seen that, but I'm not doing LIS applications every day. So if something's changed, by all means, someone correct me. But secondly, I know back in the day, like when I first started, you could do that. I don't know of any instances where I'm pretty sure Cigna doesn't allow that. I don't know of any carrier that will allow a special election for LIS based simply on the fact that an application has been submitted.
Okay. All right. Just wanted to check and make sure.
Hey, John, I got a question.
Sure.
I know you went over LCC, losing credible coverage. Is OCC, other credible coverage, still an SEP? I didn't hear you talk about OCC.
When you say OCC, frame that up for me.
Other credible coverage. That's the SEP. Because what we used to use that with is somebody's got an existing Medicare Advantage plan, a MAPD, or they had just prescription drug coverage, and they had VA coverage or were awarded VA coverage, that would generate a SEP that, because they have other credible coverage through another agency, in this case, the VA, so they would be able to change out of their existing plan to an MA only, so they can use the VA in their prescription drug plans.
I don't see that as an option. I'm not saying that it does not exist. I'm not familiar with it. So if you have more insight on that, I would love to hear it.
I'll research that out and let you know on Wednesday.
Fair enough. Thank you. Anyone else?
Yeah. Hey, John, let's say you mentioned the chronic SNP, like let's say someone has diabetes. So just so I understand, let's say it's July. Let's say they're just on original Medicare and a drug plan. Would that give them, if they say, yeah, I do have diabetes, can I get them on in July? Or let's say they're on a Medicare Advantage plan, can I get them on that plan?
Yes. So if someone is eligible for a chronic SNP program, meaning they have the condition that applies to the specific plan and they live in the plan area, then they have that opportunity to change it. It doesn't, you're emphasizing July, but it doesn't matter when that is. Is there a reason why you're emphasizing July?
I guess because it's not no election. But and all you have to do is literally say, yeah, I'm a diabetic. And does it matter if they're on insulin and or just the medicine, or is it specific of what type of diabetes?
Great question. So there is an attestation that their primary care physician is going to need to submit. Their doctor has to attest that this person has diabetes. So as long as their doctor says, yes, this person has diabetes, then their treatment doesn't matter. They're diabetic and they're eligible for a chronic SNP for diabetes.
And it doesn't matter any time during the year, except for annual enrollment. It would be a January 1st though, right?
Well, if you're doing an AEP application using AEP as the election period, that's what makes it effective January 1. This, remember that fourth quarter restriction applies to LIS, state pharmaceutical assistance, and Medicare savings programs. It doesn't apply to chronic SNPs.
So you could have someone November 1st, you talk to them, they tell you they're on a Medicare Advantage plan and or original Medicare, and they're, oh yeah, I got diabetes, and there's a diabetic plan in that era. You could sign them up for a December 1 effective date.
Correct.
Okay, thank you.
Yep.
And John, that covers type 1 or type 2, and even if they're just on metformin, they don't have to be insulin dependent to qualify. Exactly. It's just got to be the attestation from the doctor showing that they have diabetes.
Right. Absolutely. I mean, their doctor could say, yes, this person has diabetes, but it's being controlled by their diet. You know, but the diabetic, the question becomes, what benefit are they getting out of it? They're not taking any diabetic medications, but they do have a special election, yes. Great question. Anyone else before I turn things back over to Tony?
Great job, John.
Thank you, thank you. So the last thing I want to leave you guys with is, again, the reason I went about it this way, number one, instead of, there's already a 15-page document available for this, creating a whole PowerPoint, just replicating what already existed and makes sense. But I also wanted to make sure that you're aware that the resources between Google and definitely Medicare.gov, because you're getting the right information from Medicare.gov. When you go to Google, you have to consider the source. I tend to have a short list of resources that I will select when I Google something. Medicare.gov, if it's on their site and something goes awry, you can always point back to them and say, well, look, you told me this, okay? If the information is not right, they're liable and responsible for it. If you go to Google and you pick Joe Blow, who winds up putting something on his website and that's not your get out of jail free because you found it on the internet. You want to make sure it's a credible source. All right.